Why are individual bladder sensitivities like a unique fingerprint? Imagine your bladder as a tiny, complex sensor that tells you when it needs attention. No two bladders feel exactly the same, much like how fingerprints are unique to each person. This is because bladder sensitivity is shaped by a mix of biological, neurological, and environmental factors that are different for everyone. One key reason is how nerves connect to your bladder. These nerves send signals to your brain about fullness, urgency, or pain. The way these nerves are wired and how they process signals can vary from person to person. Some people might feel a strong urge to go when their bladder is only half full, while others might not feel anything until it's very full. This neural diversity makes each person's bladder sensation unique. Another factor is the bladder lining, called the urothelium. Its permeability, or how easily substances pass through, can differ among individuals. If the lining becomes more permeable or inflamed, it can make nerves more sensitive, leading to heightened sensations or discomfort. Past bladder infections or inflammation can cause lasting changes in how the nerves respond, further customizing each person's bladder experience. Recent studies also show that the bladder hosts its own microbial community, sometimes called a microbiome. Although the bladder was once thought to be sterile, we now know that each person has a distinct urinary microbiome. Changes in these microbes can influence bladder health and sensations, adding another layer of individual variation. People with bladder conditions often report different symptom patterns, which reflected their unique sensory experiences. Researchers have used advanced techniques to identify different symptom clusters, showing that bladder pain and discomfort are not the same for everyone. These differences highlight how personalized bladder sensitivities truly are. Understanding this individuality is important for prevention and lifestyle choices. What irritates one person's bladder might not bother another. Common triggers like certain foods, drinks, or medications can affect people differently. Recognizing your own sensitivities allows you to tailor your habits, such as avoiding specific irritants, to protect your bladder health. This personalized approach can help reduce irritation and lower the risk of developing more serious issues like bladder inflammation or even bladder cancer. In summary, your bladder sensitivity is like a fingerprint because it results from a unique combination of nerve wiring, bladder lining health, immune responses, microbial makeup, and personal health history. This complexity shows why a one-size-fits-all approach doesn't work for bladder health. Instead, paying attention to your individual responses and working with healthcare professionals can help you develop strategies that suit your specific needs. Always remember, maintaining bladder health involves understanding your body's signals and making lifestyle choices that support your unique bladder profile.